Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958. Washington Hospital Today is provided for the sole purpose of informing residents about healthcare topics and issues that have been covered during community forums, free health and wellness classes, or as part of educational sessions held during the district's open board meetings. This program is one more way that Washington Hospital helps empower you, the residents of the district, by providing information needed to make informed decisions about your health.
Today's presenter is Kristi Caracappa. Kristi Caracappa is the Health Insurance Information Service Coordinator for Washington Hospital Healthcare System. She has held this position since 2009. Kristi provides information to community members to assist them with making informed decisions regarding healthcare coverage. Kristi can provide assistance with Medicare, Medi-Cal, as well as private insurance and other government or community-based health programs. Kristi is a certified applicant assistant for Healthy Families, which is a government-sponsored health insurance program for children.
So what we're going to cover today, Medicare is very complex. You probably get a lot of information in the mail and may have gotten your Medicare and You 2012 book, which has quite a bit of information. So we're just going to try and narrow things down a little bit for you. And we're going to talk about who qualifies for Medicare, how does Medicare work, 3 different ways to utilize your Medicare. So let's start off. The main principle of having this seminar tonight is we get a lot of phone calls from people who are going to turn 65 this year. So instead of waiting till their birth month of turning 65 and being concerned about what to do, we thought, well, let's try and be proactive and have people come out and we'll try and go over it with you and answer your questions. And we'll also going to talk about if you qualify through Social Security disability and other ways to qualify for Medicare. So when you turn 65, if you meet the qualifying events for Medicare, you'll have 7 months to sign up for it. There's 3 months before your birthday and 3 months after your birthday. If you're planning on receiving your Social Security benefits at age 65, in most cases, Medicare will send you your Medicare card with your Part A and Part B benefits. So for example, you're 64, you've notified Social Security that you're going to retire and you'd like to go ahead and start taking your benefits, then they're going to go ahead and start Medicare for you. If you're not taking your Social Security benefit, then you need to call Social Security and tell them that you want your Medicare card, okay? So, qualifying events for Medicare, how you qualify. You're eligible for premium-free Part A if you're 65 or older, and you or your spouse has worked and paid Medicare taxes for at least 10 years. And that doesn't have to be 10 consecutive years. It could be broken up, but throughout your life if you've paid Medicare for 10 years. If you're receiving retirement benefits from Social Security or Railroad Retirement Board, if you or your spouse had Medicare-covered government employment, and if you are on kidney dialysis or are a kidney transplant patient, you automatically get Medicare. So as you see, there's a lot of different ways Medicare comes about, so we're going to try and simplify it for you. Qualifying events for Medicare if you are under 65. So if you're under 65 and you're wondering if you can get Medicare, you may qualify for Medicare disability if you meet the following requirements. You have been entitled to Social Security or Railroad Retirement Board disability benefits for 24 months, which means if you are qualified for Social Security, you're on disability and you have Social Security, the day that happens, 24 months later, you qualify for Medicare. Also, if you have Lou Gehrig's disease, your Medicare benefits begin the first month you get your disability benefit. And if you're a kidney dialysis or transplant patient, you automatically start on Medicare. So if you're over 65 but did not pay Medicare taxes, if you or your spouse did not pay Medicare taxes while you worked, Some people are self-employed and don't pay into it, and other events might occur that people don't pay into it. And if you're 65 or older and a citizen or permanent resident of the United States, you may be able to buy Part A premiums. You can contact your local Social Security office for current monthly premiums. The premiums for Medicare, change yearly. Sometimes they go down, sometimes they go up. So basically, I'd like to go back a little bit. If you're 65 and you worked your 10 years, you automatically are entitled to Medicare. If you're at 65 or older and you have not worked those 10 years or the 40 quarters, then you should contact Social Security and find out if you qualify for Part A premium, which means if you are 65 and worked, it's free. If you did not pay into it, then there is a premium that you can buy. So Medicare Part A and B. So let's talk about the difference between A and B. Part A is hospital insurance. There's no monthly premium if you've earned it. It helps cover inpatient care in hospitals, helps cover skilled nursing facilities. And Part B is medical insurance. It helps cover doctor services, outpatient care, and home health care. It pays for some preventative services, and for 2012, new Medicare recipients will pay a premium of $99 for Part B or more depending on your income. So for this year, it actually went down to $99, and depending on your income, it may cost more. But we have some literature here afterwards that you can go through, and it has a chart in it that shows that. And you could always call Medicare too. So this is what a Medicare card looks like if you haven't seen one or don't already have one. And you should keep it with you at all times if you're on Medicare. And you would present this card to your doctor or healthcare provider so that they can bill Medicare properly, and then you won't get a bill. Okay, Medicare deductibles and coinsurance. Now with Medicare, Part A and B, Part A is a free premium, and it does have a deductible. So the Medicare Part A deductible is $1,156 for the first 60 days with no coinsurance. So that means if you were to go into the hospital, you would pay that deductible for at least 60 days at hospital stay. And then Medicare Part B is $140 a year with a $20 coinsurance for some services. So what that means is Medicare Part B, if you go to the doctor the first time and your doctor charges you $140, your deductible is done for the year. You may have a 20% coinsurance depending on the service, but everything else is covered for the year. And in your Medicare book that you'll receive, and we do have some here tonight, it'll tell you what services are covered 100%, like preventative services, and what services you may pay a 20% copay. Okay? So here we have Medicare basics. There's 3 ways to take your Medicare. The one way is what I just presented to you, which was your Medicare card, having that deductibles, and paying a 20% coinsurance. That's if you just have your Medicare card and you have nothing else. Here, what this chart is going to show you is there's two other ways you could take it. If you have your original Medicare, you have your A and B. And then you also should get a Part D drug coverage, prescription drug coverage. And then step 3 for having your Medicare and the things that go with it would be a Medigap. So that's one way of doing it. And basically, most people get either an Advantage plan, which we're going to talk about on the other side. They either get an Advantage plan or they get a Medigap policy. With a Medigap policy, you use your Medicare, and then your Medigap policy comes into play. It takes care of whatever Medicare doesn't take care of, and it's a PPO, so you could go to any doctor or hospital that takes Medicare. On the other side, we have a Medicare Advantage plan, okay, which is also known as Part C. If you've ever heard of Medicare Part C, it's typically, especially in this county, all-inclusive. It covers your A, your B. It covers your D is usually involved in there, which is your prescription drug coverage. And then you pay a premium per month, and oftentimes there's a co-payment, okay? I like to use Kaiser as an example of a Advantage plan. So if you don't have your regular Medicare, you might have Kaiser or HealthNet, you might have heard in this area, or Secure Horizons, which is actually under the umbrella of AARP. So if you hear those terms coming up, you'll know, oh, okay, if I have Health Net Advantage plan, that would be an HMO. I'll take your question, and then we're going to, can you wait, or do you want to? Okay, thank you. Okay, so let's talk about Medigap supplements. Okay, that's where you have your Medicare card and you present it to your healthcare provider. So a Medigap supplement is insurance that complements original Medicare. It takes care of the things that Medicare doesn't cover. A Medigap is supplemental insurance that fills the gaps of coverage in original Medicare. Typically, with Medicare A and B, recipients will purchase a Medigap plan. These plans are lettered A through N, and they are sold by private insurance companies, but are regulated by Medicare. The plans A through N, I think I have that in here, we're going to go through them, and I also have booklets on it in the back. They're plans A through N. They cover all different kinds of things. They cover maybe the Part A deductible, but maybe it doesn't cover the Part B deductible, and then there's check marks, and it'll show you what it covers. The basic plan is Plan F or Plan N is what people usually take in this area. So, and of course, no matter who you purchase your plan from, the coverage is the same. So for example, if you go to purchase it and you go to Blue Cross and they have Plan F, and you go to AARP and they have Plan F, they're going to have two different prices, but the coverage is exactly the same. It's regulated by the government. So you basically want to choose it by service and price, how it fits into your budget. Some people pick it by preference. Some people just don't like one company because they had a bad experience, and they love this company because their friends are on it. So it's kind of up to you, but your coverage is going to be exactly the same. Here's the chart I was talking about. So plans A through N. If you look at Plan F, in the middle, it has check marks all the way down. And the thing when you buy a Medigap plan, you can go down in plans after you purchase it, but it's a little harder to go back up. So if you were to start out with Plan N, you more than likely wouldn't be able to switch to Plan F after the fact. But what you'll find when you go to price them, the Plan F is not that much different of a price than Plan N. So that's usually why people go ahead and just get Plan F. And then once I find seniors that'll come in to see me, they'll say, oh, my premium's getting real high. I had Plan F since I was 65, and it's getting really expensive. We always send them to an insurance broker who helps them, and typically Plan N actually ends up to work out for them for the remainder of the year. And with the premium is different, and although you have to pay the yearly deductible. So what is Part D? Part D is a prescription drug option run by Medicare-approved private insurance companies. It helps cover the cost of prescription drugs and may help lower your prescription drug cost and help protect against higher costs in the future. So Medicare doesn't cover your prescription drugs unless you have the Part D drug plan. And Part D drug plan, there's over 20 Medicare prescription drug plans to choose from. Each plan is unique in coverage. And if you have a Medicare Advantage plan, you may have a Part D plan built in. If you live in Alameda County, all the Advantage plans do have Part D built in. So before we talk about Medicare Advantage plans, I just want to go back to Part D plans real quick. If you were to purchase a Medigap plan, typically you keep that Medigap plan just on through your senior years. You don't change it unless financially it starts getting a little cumbersome because the premium goes up. But with your Part D, when you purchase that plan, you want to look at that every single year. Because there's so many plans during open enrollment, if you don't look at it, one of your drugs might not be on, maybe it's on the formulary this year, but it won't be on next year. And once open enrollment is over, you're stuck in that plan, and your prescription may not be covered. So if you choose a plan this year and the premium is $14 and they cover one of your prescription drugs and you don't check it out, they could up the premium to $75 and not cover that drug anymore. And there's nothing you could do till the following year. You could drop the plan, pay out of pocket, but that's not going to be very good. Plus there's penalties. So that is one of the big things we do here at the end of the year. We're very busy from October 15th through December 7th We take appointments. You bring your medications in, and we look at the Medicare website together, and we help you choose the best plan for you. Okay, it's quite a formulary. So Medicare Advantage plans. So we discussed earlier, they're called Part C or MA plans. They're offered by private insurance companies, approved by Medicare. They cover your Medicare Part A and B, and you may have co-payments. You no longer use your Medicare card. You keep your Medicare card in your desk. You don't ever want to get rid of that. But you would basically just be using your Advantage plan card, because what happens is Medicare is now paying your Advantage plan to say, hey, thank you for taking care of Mr. and Mrs. Smith. We're going to hang out over here and you take care of them. So while you're with original Medicare, you're managing your Medicare yourself. If you go on an Advantage plan, they're managing it for you. And there's co-pays and so on. So you no longer use your Medicare card. Let's see, they must cover all services that original Medicare covers except for hospice care. And original Medicare will cover hospice. Medicare Advantage plans may offer extra coverage such as vision and dental, and Medicare plans are not supplemental coverage. Okay? So let's try and just gave you a lot of information there. So Medicare Advantage plans, typically the difference between having original Medicare with a Medigap, like the plans A through N, it's over here, and your Medicare Advantage plan, typically out-of-pocket premiums are higher with your Medigap plan, your plan A through N, but there's typically no co-pays. When you go to the hospital, if you have, I'm going to speak of Plan F because that's the most popular plan. When you go to the hospital, it's covered. Everything's covered. You don't have a deductible. You don't have a co-pay. Okay, whatever Medicare covers or doesn't pick up, your supplement will pick up, your Plan F. Okay. Now, Medicare Advantage plan, typically the premiums are less. You pay less money per month, but you pay co-pays. So maybe your Advantage plan, I don't really know all the prices, but let's say it's $100, and your Advantage plan is $75. And if you don't go to the doctor every month, you're going to save $25 a month. But when you do go to the doctor, you're going to have to pay that copay. And if you have to go to the hospital, most of the plans have a fee, usually from anywhere from 1 to 6 days, $250 a day. So the money you saved for the year by being on the Advantage plan, you can lose by having to go to the hospital. Then you made up the difference. So do you see how that works? And it's whatever you're comfortable with. They're both good plans, but it's just whatever you're comfortable with. For example, Kaiser. If some people have been at Kaiser since they were babies, and they turn 65 and they want to stay with Kaiser, it's an Advantage plan. So it's ran a little different, but they're okay. People are okay with it because they've already know all the doctors, they know the facility, they're more comfortable. They will have to pay co-pays. Their Part D isn't in there, so it is in the package. So they are covered with their drugs, they have co-pays. But you don't have the freedom of going outside of Kaiser because you're in that Advantage plan. So it just depends on how you want to take your Medicare. I got ahead of myself. So each Medicare Advantage plan charges different out-of-pocket costs and have different rules on how you get services. So for example, with a Medigap plan, you're in control. If you feel like you want to go see a cardiologist, you can go see a cardiologist. You do not have to be referred. If you're with an Advantage plan, typically you have to go to your primary care physician and then they will refer you. So you're in medical groups. So Kaiser has its own group. If you have HealthNet, HealthNet has Hills Physicians, Bay Valley, Palo Alto Medical. You choose a group and you have to see the doctors and specialists within that group. And then these rules can change each year, which brings us back to open enrollment. If you're in a Medicare Advantage plan, you want to try it out. The nice thing is you don't have to be in it forever. If you have it for a year and you're not happy during open enrollment, you can change back out of it into a Medigap plan, or you can change to a different Advantage plan. So you have every year you could change. And also every year if you were in a Medigap plan and you decide you want to join an Advantage plan, you could also do that during open enrollment. Okay? So if you're 65 and receiving insurance benefits from an employer, Often people work past 65, they'll go to 70, 75. So for example, if you're working with your employer and you have medical benefits and you are 65 and you are eligible for Medicare, Part B of your Medicare is, what do we say, $99 a month. If you have credible coverage through your employer, you don't have to take that B and there is no penalty. So if you're planning on staying working past 65, you can give us a call and we could kind of help direct you. Or you could call Social Security and give them your scenario and they'll help you. But basically, don't take Part B if you don't have to. If you're already covered and it's credible coverage to Part B, which means it's the same or better than what you would be getting through Medicare, you would not have a penalty. And then when you decide to retire and go full Medicare, let them know about it. I'm not sure, I'm just saying off the top of my head, probably give them a month, let them know, hey, I'm going off of my employer's plan and I want to take on my B. They're going to ask you for a letter saying that you were covered all the time from the time you were 65. And if your insurance changes between 65 and when you retire, each time it changes, they should be giving you a letter saying, that you had coverage. So you can present that to Medicare. They say, oh good, you've been covered. Welcome to Medicare. No penalty for you. So you can, as this says, you can elect to put it on hold. And it's important for you to check with your employer to make sure that the coverage you have is credible coverage. So don't just assume that, oh, I'm covered. Make sure it's credible coverage to Medicare. Because then if you wait till down the road and find out, then you'll have a penalty that stays with you for the duration of Medicare. So open enrollment, we talked a little bit about that. In the fall of 2012, this year, the annual enrollment period is October 15th through December 7th. And if you want to make changes to your Medicare Advantage plan after December, you will have from January 1st to February 14th to switch to original Medicare. You will have until February 14th to also join a Medicare Part D prescription drug plan. Let me explain that to you a little, simplify this. It is in the fall of 2012. Typically you're going to be looking, if you have a Part D plan outside of a Advantage plan, you're going to want to come look at that and make sure it's still a good plan for you. And if you decide to enroll in a Medicare Advantage plan at that time, let's say you're on a Medigap plan or you're changing Advantage plans and you get into this plan and you start using it in January and it wasn't what you thought it was, this is actually a new rule for Medicare. They'll let you get out of it up until February 14th. You can get out of it and go back to original Medicare and still get your Part D prescription drug plan. So it's a little safety net for you. Whoops, I got in here. Maybe you got a phone call from somebody that said, hey, why don't you join our Advantage plan, and it's so much cheaper. And then once you get into it, you find out that it wasn't what you thought it was. Boom, you can get back out. The only thing is it might be difficult for you to get a Medigap plan. I'll get you after we're done. Okay, so another thing, you'll have this in your handout, the Medicare number and the Medicare.gov website. And I put in here the Medicare and You 2012. We have books in the back. Every year, if you're not sent one by Medicare, you can go to this website, Medicare.gov, search for the Medicare and You 2012, and it shows up in a PDF. Or you can call the number, and they will mail you a copy. And you should take a look at that every year. It's very nice in the front cover. It shows you, it just tells you what the changes are. Then you could go to the area and look to see if those changes make a difference for you. But you should look at it every year. Scams. Health insurance companies must be licensed with the state of California. And before you purchase a plan, ask to have information sent to you on the plan details. We like to talk about scams because when people turn 65 and during the open enrollment period, if anybody still has a fax machine, because we're doing all scanning and emailing, it seems, and you'll get a lot of emails saying, oh, Medicare Advantage plan, great for you. And it'll be by Friday, it's only this much money. Insurance is never on sale, and there is no expiry date. And if somebody calls you and it sounds too good to be true, you ask them for a packet. Say, that sounds great. You send me a packet? Oftentimes they'll either hang up or they'll say, well, I can send you a packet if you give me your credit card information so I know that you're really thinking about buying with us. Well, then nope, insurance is pretty straight up, straightforward. So if it sounds too good to be true, it probably is. You could always call our department, and we'd be happy to run it for you and see if they are licensed with the state of California. So we are the Health Insurance Information Service Department. We have lots of things here. They have our phone number on it. We have your handout. We have pamphlets in the back. We're available all year to help you, your family, your friends. We do a lot. I'd like to tell you that we do a lot with children for children's insurance, and we're helping a lot of people with pre-existing conditions, because with health care reform, the rules are changing on how people get insurance with new government programs and things, and it's worth a try to get on those. And I just like to, well, that's a seminar for another day that's in your book. So we'll go ahead and start with some questions. Marie's going to come around with the microphone, and if you can wait for the microphone to ask your question, that'd be great. I think we have somebody right up front.
Hi, do the rules change from state to state, for instance, in Georgia?
Well, let's see. If you have a Medicare Advantage plan, yes, they do change or can change. So an Advantage plan, like Kaiser's not available all over the United States. It's in regions. HealthNet, it's basically by your county, okay? So there's 4 Advantage plans. Kaiser, Blue Shield, or it's Blue Anthem, anyway, let's just say Anthem, HealthNet, and AARP, and in our county. So if you were in our county and you joined one and you were moving, you would need to change Advantage plans. And you would not have, if you're moving, you wouldn't have to wait till open enrollment. That's a special enrollment. Yes, so you would be able to do that. And if you're on a Medigap plan, that works all over the United States. But your drug plan, you would have to change if you moved. Yeah, but if you're traveling, it's always covered. You would check with your plan. Okay?
Good evening.
Good evening.
Question that I have in terms of what are the penalties for early cancellation? We're talking about the Medicare Advantage plans.
Okay. There are no penalties for early cancellation, but there would be, if you were to drop the Advantage plan, there wouldn't be a penalty. But where the penalties would come into play would be with your Part D, if you had no prescription drug coverage for any period of time, you would be penalized. And off the top of my head, I'm not, it's like 10% of the average plan every month you were off. It's quite a little formula. So, okay.
Hi, I'm a veteran. Is it necessary that I have Medicare? Because I have full benefits to the veterans.
Depending on the level you have with the veterans, they'll tell you if you need to have the Medicare.
Well, I've been with the veterans for the last 15 years with full benefits. So when I turned 65, just prior to that, I started receiving, or they started deducting Medicare out of my retirement.
They have been deducting okay, then you do, they're deducting probably that $99 or
$115 to be exact.
Okay. You need to contact them, and you need to contact the veterans, because yes, in some cases they do require you to have your Medicare. Now, when is your birthday? Are you 65 now, or do you mind me asking in front of everybody?
I am 65.
Okay, and when, this year?
No, last year.
Okay. Actually, you should check. You may be paying $99 now, but yes, they're requiring you to have A and B.
Okay, so because I have never heard anything from the veterans about it. It's through the railroad retirement that I work for. They're the ones that are deducting it.
And who is your retirement through?
Railroad retirement.
Okay. Wow, you've got a lot going on there. You have the VA and the railroad. I would contact the VA, because they're going to be your number one coverage, and ask them if you have to be, and then you would have to go through the railroad. So, Marie, he still has another question. I'm just going to say this to you. Can we talk afterwards? And I have a card in the back, and I think that you need an appointment. because you do want to make sure that you're not paying for something you don't need to have, especially with railroad and the VA. And the VA is, I know, great coverage, and they also cover a lot of prescriptions and so on. So yeah, you and I need to sit down and talk about what you've got going on and make sure you're on the right path. So, thank you.
I think you answered the question, but I want to make sure. I've signed up my husband. He has early onset Alzheimer's.
Okay.
And so most of it is medication. And it's, when I went to the Social Security office and everything's done, it starts July 1st, they said A and B that the D was all inclusive. Is it because he will be on Kaiser Senior Advantage?
Yes.
Okay, that's what I thought when you went through that. But the other thing is then does a Kaiser Senior Advantage cover the part, you always hear about the donut hole thing? I mean, like, is it just a co-payment through Kaiser that for the medical, for the prescription? Because most of his costs are the high prescriptions for the medications.
Okay, you bring up a really good question. Advantage plans in your Part D, yes, the donut hole is involved. We have a whole nother seminar in October about Medicare Part D. It's all by itself because it's such a big entity of Medicare. And it's a lot of times where seniors get into trouble financially is because of that. But Part D, you do, with Advantage plans like Kaiser, you do go into the donut hole.
You do go in.
Yes.
So at that point, then it's out of pocket.
For a certain amount of time.
Yeah, and they've changed that a little. I know they tweaked
Yeah, and
it,
I'll talk about that a little bit right
Yeah.
now. First of
And I
all,
just-
for those who don't know, the donut hole sounds absolutely delicious, and it's not. It's not. They should
Lots
have
of
named
calories.
it. Yeah, they should have named it the yucky medicine or something, because it is not delicious at all. But it has gotten much, much better with healthcare reform. I've been here for 3 years, and in my first year here, my appointments when I saw seniors with their Part D would be an hour, and a lot of calculating and back and forth and figuring out. Now with Medicare Part D, with healthcare reform, they cut it so that when you're in the donut hole or the gap, the coverage gap, you pay 50% of your medications until you've reached a certain dollar amount, and then you go what's called catastrophic. And please don't even try to understand that if you don't right now, because come to our seminar in October, or if you're turning 65, make an appointment. Make an appointment, and I'll sit down and go over it. We also have in the back, it's a smaller pamphlet, and let's see if I brought it up here. I didn't. It's a smaller pamphlet, and it talks about the coverage gap closing, and it's supposed to close in, I think, 2014 it should close. So it's actually gotten better and better.
And then there's just one other question. I'm looking for a job right now, and so if, let's say he gets on he's going to start Medicare July 1st, and the Senior Advantage with Kaiser. We have the regular Kaiser now paying big bucks on the individual with no pre-existing testing. But anyway, if I get another job that has the good medical that covers for both, is it okay to take him off the Medicare and have him covered by the whatever corporation I work for?
Yes,
Once he's on it.
He's
Once he's on
65 now?
No, he's a Social Security disability.
Disability,
62.
Okay. Yes, he can go off of it, but as long as the coverage you have is equal to or better.
Which is probably better, yeah.
Right, so you need to notify them that you're going off of it, because now he'd still keep his
I'd
part.
have to let the company know, because they might say, hey, why should we pay or something if he's on Medicare? Or, I mean.
No, if a company, typically with a group coverage through an employer,
Yeah.
if they say they take your spouse and your children, typically there's.
So I don't have to
Yeah.
mention that he's on Medicare, or I wouldn't want
You
to
know,
get in trouble.
okay,
you
I
know,
always
like-
say the best way to stay out of trouble is
Is to let
complete
them know.
disclosure. Yes, let
Okay,
everybody know
yeah.
what's going on, so you don't get in trouble later. Because if you did take him off and put him on yours, and they said something, although I don't think that they would, but I find it's always better to say, hey, this is what I have. What do I need to do? Don't try and keep anything from them. Okay. Anybody else?
Hi, good evening.
Oh, hello.
I already got my regional Medicare
Uh-huh.
because I just retired. I'm turning 65 this July. But I am also entitled with TRICARE because I'm a dependent of my husband who's military.
Okay.
I wonder if there's any need for me to buy another, the Medicare.
Okay, you have TRICARE for life?
Yes.
Okay, through your husband?
Yes.
I don't think so, but I would check with TRICARE, and they'll know that you're turning 65, and they might switch your plan up a little bit. But I would talk to them and find out if you need anything else, or when you find out what they are offering you, you can make an appointment with me. I can look it over and tell you if there would be more covered on Medicare. But my understanding is with the VA and TRICARE for life, you're pretty set. But it's like I said, it's always good to double check with the people who are giving it to you, and if you want somebody to look it over with you, I'd be happy to do that. And happy birthday.
Hi, good evening.
Good evening.
I got a question on this Medicare. Can this Medicare cover outside the country?
Ooh, it covers, depending on the plan, like Plan F covers, I believe it covers foreign travel, and how it covers is you would pay while you're there,
Okay,
and then you would bring your bills back. Now, I think they would only cover what Medicare covers, so it's a certain percentage.
Oh, okay.
But there is coverage if you leave the
Like-
country. Mhm.
Like emergency or something?
Exactly. If you had some if you're going for a treatment or something, they probably wouldn't cover it. But if you are traveling and you have an accident, it is covered to a certain extent.
Thank you.
Before you travel, it's always good to check with Medicare and find out what to do if you have an emergency while you're out of the country. Yes.
You talked about travel, but what about if in your retirement years you want to live in part of the year in another state? So that obviously you wouldn't want a PPO, but like I'm thinking in terms of in my retirement years, living with family on the East Coast for maybe a few months out of each year, but still living in California too. So a Medigap plan, would there be problems with?
No, a Medigap plan is a PPO, and that would be something that would be better for you.
A PPO?
Yeah, so Medicare with a Medigap is a PPO, because you can go to any doctor that you want, okay? And then an Advantage plan would be more difficult, because if you're living somewhere for an extended period of time, then they're gonna want to have you switch to another Advantage plan. So you'd be switching every 6 months, because when you move, that is a special enrollment period. And then the other thing is, if you had a Medigap, okay, which is your PPO, and you have a Part D drug plan, you'd have to check with the drug plan on how that would work, but it should be fine, because if you choose a plan that has like a CVS or a nationwide pharmacy, you should be okay. Okay. Oh, 1 second, somebody's.
Okay, my question is, when my husband retire anytime, maybe in the next few months, and he has coverage from the company, and he has Survivor. The only thing I found out, he won't have any more coverage for dental and vision. So what does he need to do to be covered?
When your husband retires, will he be 65?
Yes.
Okay.
Yeah.
Well, with a Medigap policy, which is your Medicare, with your Medigap, like your Plan F, and then your Part D, you could also buy through Delta Dental. I'm just using it as an example because it's big in this area. You can buy dental coverage separate, but it's not Medicare. So Medicare doesn't cover any dental.
Yeah, right.
So
now,
you can buy a separate policy, and I will tell you, I've never had anybody, and if anybody here has awesome senior private dental, let me know. But usually it's just really basic coverage. You know, your twice-a-year cleaning, your X-rays, and 50% on any major work.
Right. His current coverage right now is through Kaiser. So
Kaiser is an Advantage plan, and they also will offer you, not within the same plan, it's an add-on. So if you got Kaiser Senior Advantage, I think it's $79 a month. is what I saw on the Medicare website. Then you could do add-ons for vision and dental.
So that's extra
Mhm.
out of pocket.
Mm-hmm.
Okay, thanks.
Oh, sure. Up here, this lady has a question.
I wanted to find out what is the major difference between Medicare and Advantage plans?
Okay.
Does Medicare include?
Oh,
sorry.
I got
Does Medicare include Part D?
Okay.
Prescriptions?
So her question is, what are the major differences between a Medigap and an Advantage plan?
Yes.
And is there Part D in a Medigap?
Yes.
Okay, the major differences are going to be your premiums per month between the two. A Medigap offers you more freedom of where you go to get your services. You choose any doctor that will take Medicare, okay? It does not include Part D is a package because you don't have a package. You have your Medicare, you have another card that is your Medigap, and then you will have a prescription drug plan separately that you'll purchase, okay? So you basically have 3 cards, but you're managing your own Medicare. A Medicare Advantage plan, the advantage to that is it's all inclusive in one package. It's usually the premiums are a little less per month, but the disadvantage is you pay co-pays when you go to the doctor. Hospitalization is usually much larger co-pays, and you lose the freedom of being able to go wherever you want to go.
So Medicare
Mm-hmm.
basically includes whatever is not paid by your
By your Medicare, if you choose Plan F. There's other plans that maybe they'll cover 50% of that 20%, or they won't cover your Part B deductible. So usually when you pick a plan, you could sit down and we could talk about what your needs are. Also, we refer you to a insurance broker to go over to purchase your Medigap plans. We don't sell insurance. We just explain it.
Hi, I'm on a federal employee plan.
Okay.
I wonder if I need a Part B and Part D.
Part B and Part D. I just looked up the federal. I'm hearing a lot about the federal employees have been coming to me. You definitely have the Part A. Depends on years of service, I believe, with the Part B. And it depends on how their package is put together, I guess is the answer. So I would have somebody brought me a brochure about what was offered, and there was a few different things in there. So you'd have to show me what they're offering, and I could tell you what you would need. Are you on it right now? You're on the federal, okay. You could make an appointment and we could talk about how that is working with you. Did you have some information on the federal program? Oh, you just had a question? Okay. We'll get you in just 1 second. Go ahead.
Hi, I'm going to be 66. I did not apply for any Medicare or anything at all. Kind of like denial, maybe. But I am
okay.
still working.
Okay.
And I'm not sure if I'm going to semi-retire or what when I turn 66. But I am covered by my husband.
Okay.
And he has really good, medical insurance, and he's 7 years younger, so it'll be a while before he retires. So I'm kind of wondering what I should do when I do turn 66 as far as
what
to file for.
Okay, we should do this right now. You're already 65, and if you believe that you qualify for Medicare, you should call Social Security, and you need to let them know that you want your Medicare card. You haven't gotten that yet? Okay. Okay, she has not received a Medicare card yet, so call Social Security. Tell them that you would, when your birthday was, and that you'd like your Medicare Part A. And I'm assuming your husband's employer has credible coverage to Part B. You might need to find that out too. And if he does, there's no penalty. It should be fine, as long as you've been covered. And Medicare may ask you at the time that you get your Medicare card, they may ask you to present that letter saying that you have credible coverage. And you should be able to get that from your husband's HR department. So you should be fine as long as you have credible coverage. But go ahead and get that A. Get your card. It's due you. You should have it. Okay? Hi.
Hi. I was just wondering, how do you figure the out-of-cost pocket share? Because I was reading in a book, it says subtract $600 from your income, and that seems very high for out-of-pocket share.
Out-of-pocket share, for what? For what are you referring to?
For Medicare Is it just gonna be $99 basic, or?
It's, Part B is $99, and then you have a deductible, and then you have 20% co-pays on some services. So somebody
Probably look at
told
that
you,
chart that's in here, right?
yeah, which chart?
That tells you're paying 50% on this plan. It depends on your plan.
Yes.
What your out-of-pocket is.
Yes. Are you talking about Medicare Advantage plans?
Yeah.
Okay, yeah, it depends on what plan you are.
Okay.
So some people go with the Medicare Advantage plans because I have people who come in, they're on one generic medication that costs them $5 a month, and they don't, they never go to the doctor, or they'll go twice a year. So they don't really want to pay the higher premium and to cover things that they don't feel they need right now. And then what you always have to keep in mind, because some people find this a scary decision on how to take their Medicare, you have open enrollment. That's what they have it for. If you have something that's not working for you, you can, always change it during that time.
And you're saying you can make an appointment. You can make an appointment with you now?
Mm-hmm.
You don't have to wait till open enrollment?
You can make an appointment with me any time of the year just to talk about whatever you want. But any changes would either have to be during your, if you're turning 65, it'd have to be during that window or during open enrollment. Okay?
If you're still working when you turn 65 and you have insurance coverage, should you still go ahead and sign up for Plan A, and even if you're going to put the Plan B on hold? Or
yes,
does it matter?
It's Part A, and yes, you should, yes, because if it's due to you, you have it, you have your Medicare. Gets Medicare and you connected for when you're ready to go ahead and get the B and then start the D.
Okay.
So it is a good idea when you're 65 to get your Medicare on board.
Yeah.
Because the A is a free premium,
Right.
so yeah, I mean it's premium free.
And like say we're with Kaiser.
Okay.
And say you were going to go to the Kaiser Advantage, but it's a real small company though, and they don't have like an HR department that can do letters. Do you think they would require a letter if you're switching from Kaiser to Kaiser Senior Advantage? I mean Medicare for the Plan B. I mean if
So right now
proof
you're
of credible insurance,
so
or just can the employer, the boss, sign a letter saying?
No, the Kaiser. Either Kaiser would be able to provide that letter.
Oh, okay.
To the employer, over to you, or I'm thinking that Kaiser just might know because you're staying in the same.
Exactly.
They might be
That's
able to
what I
talk to each
thought.
other. But yeah, either
If it
way.
would be required.
Mm-hmm. So right now you're 65. You're
I'll-
going to be 65,
yeah.
and you're going to stay working, and you have Kaiser.
Right.
Okay, and you just are going to. Your employer might switch you over to Senior Advantage. They might just put you over there if they're paying for your Kaiser. And you're 65, they may do that, which isn't a bad thing.
Okay.
And if you're curious about the differences and they give you a packet, you could bring the packet in and I could go over it with you. Okay.
I'm just wondering, right now we are debating about the Obamacare.
Uh-huh.
How would that affect our Medicare in the future if it get approved?
Well, Obamacare is a huge packet, which I have not had the privilege of reading the entire thing. I do stay informed on what pertains to health insurance as it comes out, really not for the future. I tend to try and stay with what's happening now. How it will affect Medicare in the future, like I said, I don't think I can answer that, but what I've seen is that everything has been positive. It's for seniors, it's cut the Medigap. I'm sorry, not the Medigap. There's all these terminologies that may confuse you. Let's call it the donut hole, the prescription drug gap. It's closing that gap and saving seniors a lot of money. It's also, with Medicare, their preventive services are covered now 100%. We have your Medicare and You 2012 book that I have in the back, or that you could look up online. It will show you anything with an apple usually is a preventative service and covers 100%. And every year there's more and more preventative service covered. So it's really been great for seniors. Also for people with pre-existing conditions, we've been able to help a lot more people this year that weren't able to get regular coverage due to their pre-existing conditions, and children who are dropped from their parents' health plans because they've graduated college or they weren't going to college full time. They have something, as common as asthma. They are not able to get their own insurance. They're now allowed to stay on their parents' insurance till they're 26 years old through an employer. And that is huge because most kids, when they get out of college at 21, 22, don't jump right into a job with coverage, and they're now without health care. So what I see, my understanding of it is these kids who didn't have it before were going to the ER, and they're responsible for their own bill, and they weren't able to pay it. So who's paying for it? Hospitals are writing it off, and it goes back to the government. But if we could keep these kids covered, and they're covered through health insurance, they stay healthier, and that keeps them out of places that they're not going to be able to pay for. And it helps if they have pre-existing conditions, too.
You keep saying 65 years old.
Okay.
My Social Security, the information I get says that I can't collect it unless I do it at 62, the small amount, which you don't get Medicare. But is at 66.
Mm-hmm.
Is it depending on when your birthday is, as far as when it kicks in then?
The Medicare? Or your Social Security benefit?
The Social Security benefit.
Okay,
because you don't get Medicare till you get the full social, not the full at 70, but it's not till 66 for me.
Okay, you get Medicare at 65.
Even if you don't get Social Security?
Right, you would just be paying that Part B premium out of your pocket until your premium.
Yeah, because it shows at 66.
Is when you get 100% of your Social Security, right? But you can take it at 65, but you just don't get it all.
Yeah.
Correct?
Well, like 62, but you have all the stipulations,
right.
How much money you can make. And
so basically, Medicare is 65. Has nothing to do with your Social Security income. As far as when you could collect it, you just pay for it out of pocket yourself.
And then I guess I have Kaiser now and paying individual.
Mm-hmm.
When I do go on Medicare, would I have to get a letter from my last employer, or because I'm on a medical now, then that's fine, or how would that work?
What are you on now, Medi-Cal?
No, I'm just on paying individual at Kaiser.
Yeah, they would be able to supply, Kaiser would be able to supply that.
Okay, so I wouldn't have to go back to the...
because it's whatever insurance you currently have.
Okay, because I thought that the company had to do with the tax that the money that you pay out of your wages, for the. But it's just 10 years altogether that you've
10
worked.
years altogether.
Okay,
from the time you're 13 to 65.
Yeah. Okay.
I could be
younger.
Yeah. I don't know how old you're allowed to work. So.
Yeah.
Okay. All right. All right. We have a question back there, and I just want to say some people are getting ready to go. If you please fill out your evaluation form for me, I'd appreciate it. Go ahead.
I have 2 more years to work, and I've got medical coverage. My husband just turned 65. Now, does he have to take Part A and Part B now, or
No,
can?
Go ahead.
Because Blue Shield, who's my medical coverage, sent me a letter stating he's turning 65. So because there's premiums associated, if he was to be covered under Medicare, can he not take it now? I mean, can he, or does he have to?
He does not have to take Medicare, but if he doesn't take, he should take his Part A, because his Part A is going to be free. His Part B would depend on what your coverage is. If you have credible coverage, then he does not have to take Part B, but it's good to fill out the form that says, I have coverage elsewhere, I'm electing not to take my B right now. It's always good to stay in contact with him, but if he's fully covered through you and your employer, then you don't have to. Okay, well, thank you. Yes?
Can you explain something about Medi-Medi or dual eligible people?
Medi-Medi, yes, I could explain some of that. Medi-Medi is Medi-Cal and Medicare. Okay, so if you're a Medi-Medi, your Medi-Cal is primary, and your Medicare is secondary. And how you would qualify for Medi-Cal, it's by income. Okay, so if you're lower income, then you would qualify for Medi-Cal, and you'd be Medi-Medi. Okay, and then when you have to go see doctors that take Medi-Cal, and then subsequently they would take the Medicare. Another thing is, if anybody at any time is on Medicare and they're struggling with paying for things, I always recommend, I have people that come in and we call together and say, hey, this client feels that they are having a hard time paying, and they'll fill out a form for you. We'll go through all the criteria, and you could always find out if you qualify for extra help. Extra help is not always Medi-Cal. Sometimes it's just extra help with your Part D premium. Could give you extra help for your prescription drug coverage, but it doesn't necessarily mean it's Medi-Cal. So there's Medi-Medi, which is Medi-Cal through the state of California and Medicare, and then there's extra help, which is through Medicare. Does that answer your question? Okay. Okay. Anybody else? Okay, I want to thank everybody for coming out tonight, and for those of you turning 65 this year, happy birthday. Make it a great day. And in the back we have a table with Medicare information. I'll go back there. I can answer any other questions. And if you wanted to make an appointment with me, we can work that out too. So thanks again for coming. Have a safe drive home. Thank you.